a doubling in the number of Americans who sought out emergency room treatment for opioids, and that includes women. But also, since women are disproportionately the healthcare providers, and the healthcare consumers, they're seeing it from both ends, and it is affecting them. But that also gives them a heightened sense of responsibility and, in fact, skill and opportunity to help bend the curve in the right direction. And so we're very, very hopeful about that. Just last week, the president signed into law the Interdict Act, and I thought it was a great example in the Oval Office of a bicameral, bipartisan way to show America that there can be agreement on this issue, not to put petty partisan politics in the way of progress. And so we had Democratic and Republican House members and senators standing with the president as he signed into law the Interdict Act that had to do mainly with fentanyl handling. Recently, the Department of Justice announced its first new DEA office opening in Louisville, Kentucky. We haven't had one in 20 years in this country, so it will be there. And also to designate in each U.S. Attorney's Office a special opioid designated individual who will help with this. Also, we're trying to work with those who are charged with curriculum and educating our youth that they're worth more than a pill, that they can be somebody, not a statistic. And in that regard, our First Lady has taken on this issue in a very bold way. You heard her remarks on October 26th, and prior to that, I had the privilege of traveling with her to West Virginia when she was on the ground at a center called Lily's Place, which helps with neonatal abstinence syndrome. These are our newborns increasingly being born dependent on opioids and other drugs. That has quadrupled pretty much in the last several years, the number of newborns being born dependent. And so there are many different ways that we're going about this. I also just wanted to point out that recently the Health and Human Services gave clarification on the HIPAA laws, and I think this is already going a long way to saving lives and mitigating unfortunate circumstances. Essentially, we have encountered so many families across this country who tell their story of their son, their daughter had been resuscitated 5 or 6 times, but that last time he or she were too far gone. But the parents literally say, I didn't even know he had a problem. I didn't know she was using. And I know some of those bold stories are here right with us today. And thank you for your courage and for sharing and for being on the front lines and helping other people to avoid the same circumstances as we come together. Yes, thank you very much. But basically what HHS has said is that there are circumstances, crisis circumstances, that give healthcare providers broad ability to share information with family members in those crisis situations that would not violate HIPAA. The IMD waivers that Administrator Verma's office are reviewing and issuing have been incredibly helpful. Most recently, I believe Utah and New Jersey, adding them to the list. I think we're up to 8 now, 8 states that have an IMD waiver, and the administrator can explain more about that. But essentially, we don't want the number of people who could be treated in a facility where beds are available to be enumerated by the number of beds, meaning you can't get Medicaid reimbursement if you have more than 17 beds. So we're really trying to get it in that way. Also, NIH is doing some groundbreaking work, as are some of the private companies, with respect to developing non-addictive opioids. We recognize that pain management need not mean pain medicine for all Americans, but for many Americans, they do rely on pain medicine. And that's not what we're talking